Imagine a country where, overnight, millions of its most vulnerable citizens lose their lifeline. This is the stark reality that would unfold if Social Security Disability Insurance, or SSDI, were to vanish. For those relying on SSDI, the immediate impact would be nothing short of catastrophic. These individuals already grappling with debilitating conditions depend on SSDI for basic necessities like food, housing, and healthcare. Without this vital support, many would face eviction, hunger, and a lack of access to essential medical care. The human cost of such a drastic policy shift is almost unfathomable. Families would be pushed into poverty, the already strained social safety net would be stretched to its breaking point. The sudden removal of SSDI would create a ripple effect across the nation. Hospitals would see a surge in emergency room visits as people lose access to regular care. Homelessness would rise, further straining already burdened social services. The economic impact would be equally devastating. With millions losing their primary source of income, consumer spending would plummet, potentially triggering a recession. The very fabric of our society, built on the promise of support for those in need, would be irrevocably torn. In the absence of SSDI, proponents of its elimination might point to alternative support systems. They might mention private disability insurance or state-run assistance programs. However, these alternatives are wholly inadequate to fill the void left by SSDI. Private disability insurance, often prohibitively expensive, comes with stringent eligibility criteria. Many SSDI recipients would likely be denied coverage due to pre-existing conditions. Even for those who qualify, the benefits rarely match the level of support provided by SSDI. State assistance programs, already operating with limited resources, would be overwhelmed by the sudden influx of millions of newly eligible individuals. These programs, designed to provide temporary relief, are not equipped to handle the long-term needs of people with disabilities. Furthermore, eligibility requirements for state aid vary widely, creating a confusing and unequal patchwork of support across the country. The elimination of SSDI would leave countless individuals falling through the cracks, further exacerbating existing inequalities. The consequences of eliminating SSDI extend far beyond the immediate crisis faced by current beneficiaries. For those who might become disabled in the future, the prospect would be daunting. Without the safety net of SSDI, the risk of falling into poverty would be significantly amplified for anyone facing a sudden illness or accident. This uncertainty could discourage individuals from seeking necessary medical care, potentially worsening health outcomes and increasing long-term healthcare costs. The fear of financial ruin could also prevent people from pursuing education, starting families, or contributing to their communities. The elimination of SSDI would send a chilling message that as a society we are no longer committed to supporting our most vulnerable members. It would erode the fundamental belief that everyone deserves the opportunity to live a dignified life, regardless of their physical or mental capabilities. The potential elimination of SSDI highlights a larger and deeply troubling reality: the precarious state of Social Security as a whole. While not currently on the table, the mere suggestion of such a drastic measure underscores the urgent need for comprehensive reform. The program faces significant financial challenges, driven by an aging population and rising healthcare costs. Recent legislative changes, while well-intentioned, have further strained the system, accelerating the timeline to potential insolvency. The Social Security Fairness Act, while providing much-needed relief to some retirees, adds to the program's financial burden. Meanwhile, proposals to eliminate taxes on Social Security benefits, while politically popular, would primarily benefit wealthy individuals and exacerbate the program's financial woes. Addressing the long-term solvency of Social Security requires a nuanced and bipartisan approach. We need a solution that balances the needs of current beneficiaries with the sustainability of the program for future generations. Kicking the can down the road is no longer an option. The time for meaningful reform is now.